And welcome to the Dr. Bob Show. When it's really nice outside, do you like to get outside on the weekends and maybe do a little extra work or maybe run a little bit or maybe play with your children a little touch football or throw a football or a baseball or maybe even hit a baseball and slide into home? When you do that, sometimes we get injuries. Weekend warrior injuries is what I call it. We'll be spending most of this show talking about minor orthopedic injuries that occur on the weekend. My guest is Dr. Chris Shaver, board-certified orthopedic surgeon, and he deals with these problems every day. He'll answer our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about vitamin D. It helps bone stabilization, but will it prevent cancer? And what is the difference between angina and a heart attack? And what causes both? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chris Shaver, board-certified orthopedic surgeon, and we're talking about weekend warrior injuries. Chris, welcome to the Dr. Bob Show.
Thank you very much for having me.
Tell me, what are some common problems that people have when they do too much on the weekend or they play touch football and get an injury?
Well, common injuries go throughout just about every joint in the body. Shoulder injuries, knee injuries, tearing ACLs, tearing rotator cuffs, breaking ankles, breaking wrists.
So it starts from the toes to the nose.
Correct.
What's the difference between a strain and a sprain? Can somebody sprain a knee or strain a joint or muscles? Tell me the difference.
A sprain is generally localized to a ligament that stabilizes a joint. A strain is more of the muscle or the tendon. So essentially an ankle sprain is when the joint gets bent out of position just a little more than what it should, and those supporting ligaments get mildly torn. A strain is if a muscle gets fired too hard, hit too hard, or something like that, and causes those fibers to pull apart or rip.
How does a person know if it's dangerous? Is it easy as a weekend warrior if you get a strain or a sprain? Can you tell if you need to see a doctor then?
Usually you can. Most of the ones that you don't need to see a physician about are the ones that you can get up, maybe it's sore, you ice it, you take a little Aleve or ibuprofen, and you can walk it off, maybe play the rest of the game or kind of say, hey, I could probably play tomorrow. The ones over and above that probably need an evaluation to see what else may be going on here or what's the appropriate course to treat that.
If somebody has physical contact and they get a bruise, let's just say it's on the shoulder or on the thigh or on the calf of the leg, is a bruise dangerous?
The large majority of bruises are not dangerous. There are a few certain circumstances where you worry about a bruise. If the bruise seems to be kind of out of proportion to the injury that you had, if a bruise seems to be getting worse over time as far as the pain, if that part of the body, let's say your thigh gets hurt in a flag football game and the thigh begins to swell more than what it should and becomes really painful, that might be very important to be seen about.
Emergency, you need to see the doctor right away, you need to go to the emergency room the next day.
Most of them aren't, but the one thing I said is if they swell and they're expanding and getting more painful, they probably do need to see someone right about.
Let's talk about some weekend fractures. Tell me about the wrist. What are the common ways somebody hurts their wrist and what kind of fractures are there?
The most common way is obviously just falling out, outstretched extremity. We call it a Fuchs injury. The large majority of the time, whether it be a child or an adult, they get what's commonly known as a Colles fracture. That means they break somewhere near the last couple of centimeters of the radius bone, which is on your thumb side, and it fires backwards. And that can be little of nothing, or it can be a displaced fracture that needs surgery.
Can a person tell when they have a Colles fracture that it is fractured or it just hurts? How do they know when to go get an x-ray?
Oftentimes they can't tell. Oftentimes with a Colles fracture, if it is displaced, it'll make the wrist kind of look like a dinner fork. Or it will be very hard to move the wrist, and you'll get a lot of swelling and bruising around the wrist.
Tell me about a broken finger on a weekend or a stoved finger. What's a stoved finger?
Means many things to many people. To me, it means most likely like a sprain of this joint here, which is the PIP joint, or it could be a stoved finger, meaning almost a dislocation or a subluxation back or forward of the finger. Just anything that makes it swollen and painful. There's many other fractures that can happen in the digits and many other dislocations that can happen in the digits. Usually if you dislocate a finger, you're going to know it because it's going to be completely deformed out of position.
And that has to be straightened out in the emergency room by a physician?
Oftentimes it does. Oftentimes it does.
Shoulder injuries on a weekend?
Obviously, a lot of people will do things like fall off bikes and things like that, dislocate a shoulder. Generally, those things need to be put back in the emergency room. On occasion, you'll have somebody that does it themselves if they've done it before. But oftentimes they'll dislocate and we have to put it back in.
What's a dislocated shoulder like? What's it feel like? What's it look like? How does the person have a hint?
Luckily, I've never had one dislocate, but people are in severe pain. It'll look like they have a large cantaloupe in the front of their shoulder.
So there's sort of a bump out in the front.
And their arm will be stuck in a position that they cannot rotate it side to side.
Does that require surgery, or you can usually do it manually?
Well, you can usually put it back in, but a lot of the time, depending on the age category of the patient, they'll have either a labral tear, which is the soft tissue ring around the shoulder, or a rotator cuff tear associated with them.
You ever break a shoulder on the weekend?
Oh yeah, definitely.
So that can be fractured too.
Oh yes.
How do you, let's go back to the wrist or to the arm. If you break an arm or break a wrist, are there different kinds of fractures? Let's talk about simple fractures and compound fractures. Tell me the difference between all the articular fracture, green stick, hairline. Tell me about all those, because I don't know what they are.
Well, let's start with kids. With kids, there's different fractures that are like you said, the green stick or a buckle fracture.
What's a green stick?
Green stick is just basically where children can break on one side of a bone but not break on the other. And they can bend without breaking, unlike you and I, we will just break.
We just crack it in two.
And the nice thing about that is they have the potential to remodel that, to straighten it out on their own with just a simple cast or something like that. Going up to adult fractures, a simple fracture, what medical terminology would be extra-articular simple fracture, which means outside the joint, simple straight across fracture. Oftentimes those can be treated with just a cast or a splint or something like that. But an articular fracture is where it goes into the joint. If there's any real displacement with those generally need surgery to fix them, or if a fracture outside the joint is widely displaced, it oftentimes needs fixation.
When you say widely displaced, you mean like when the bone is broken, it comes right on top of it. What's a compound fracture?
Compound fracture is actually, we call them open or closed fractures now. So an open fracture means there's a cut over the fracture or the bone sticks through the skin. For many years it was called a compound fracture. The importance of that is that there's a high rate of infection. So those are generally surgical urgencies or emergencies.
Are there other weekend injuries that are common in the lower extremities?
Yeah, oftentimes we'll see
And
things like...
that's what we're going to be talking about when we come back. We'll talk about what other injuries are. There's only 15 or 20 or 50 more. So we've got a lot of information for you. But first, let's see how a person had a problem with their extremities and see how that was diagnosed and fixed by the doctor. We're talking with Carol Frohart. And Carol, tell me about you. You had an accident. What happened?
I did. I slipped on the tennis court, kind of running back, and my left leg went out from underneath me, and my left hand braced my fall. Not
That's
a
a
good
pretty
thing.
common thing to do. People fall down and they put their hand out and brace it.
It is.
Could you hear something pop or snap or crackle?
I just felt something hurt really bad.
Really bad. So,
Yeah.
did you know you probably had broken something?
Yes, I had never broken anything before, but I knew it had to be more than just a sprain because it hurt like crazy.
Did you have to put your own sort of little brace on
Yes,
it?
I did. I
And
did.
Did you go right to the emergency room? Did you wait till the next day? What did you do?
Oh, I went right to, I was playing with 3 other ladies, and I had to kind of lie down for a bit. And they called my husband, and then he came up, and we went to the emergency room.
And eventually they found that what had happened to your wrist.
Yes, it was the radius, the distal end of the radius,
Uh-huh.
kind of shattered.
It's kind of shattered.
Yeah.
And so you saw Dr. Shaver. What did
I
he
did.
What did he do to fix it?
He did surgery. I think there's like 11 pins, like a little brace.
11 pins. So
Yeah.
you did a good job.
I did. And if I'm going to break something, I
yeah,
guess
if you're going to do it, do it right.
do it right.
How was your recovery?
The recovery was fine. It was just the first couple weeks where I had to wear like a splint because you're not to rotate the arm. And then after that, it was like in a splint kind of Velcro that you could take off and shower, but needed to have it on for about 22 out of 24 hours.
Wow. And you've seen Dr. Shaver and he's dismissed you now?
I am dismissed. I'm back to my old tricks of playing tennis and golf. And
Oh, that was your left hand that you're your right-handed tennis player?
I'm a right-handed tennis player, but two-handed backhand. But the golf it's been a little more challenging.
Isn't it wonderful to have good doctors like Dr.
Oh, my
Shaver to take
goodness.
care of something like that?
Oh, because I think it would have been a long time on its own to heal. And he had even said if I didn't have the surgery, chances are it would not have healed nice and straight.
Carol Frohart, thanks for coming to the Dr.
Oh.
Bob Show. You've got a great story and a great ending. Your wrist looks wonderful.
Oh, thank you.
We're talking with Dr. Chris Shaver, board certified orthopedic surgeon, and we've been talking about weekend injuries. We've been talking about stove fingers, broken wrists, broken arms, the different kind of fractures that are there, the difference between bruises. If you've got one that's expanding, getting bigger, that needs to be seen right away. Chris, let's talk about weekend knee injuries. You see that a lot now. People come down bad on a knee and they twist their knee and their knee hurts. Tell me about what can happen and what you do about it.
Probably the 3 or 4 most common things that you can do that are significant in the knee: ACL tears, meniscus tears, sprains of medial collateral ligament, or things like patella fractures and fractures of other areas of the knee.
So when you say ACL, what do you mean by ACL?
Okay, so it's the anterior cruciate ligament. And basically what it does is it keeps the femur and the tibia stable on top of each other.
So-
So front to back and twisted.
And if that tears, does it tear all the way through, or you just get a little tear in it, or can you tell by examining the knee?
Well, you can tell from examining the knee, yes. Generally, once the ACL tears, it completely tears. I probably see one ACL sprain to every 50 ACL tears that I see.
So when the ACL tears and the knee is unstable, what do you do about it?
Well, generally, it needs reconstruction on the majority of somewhat active or athletic or working folks.
Yeah, and this is weekend warriors, so they're out running around. They hurt their knee, they tear the ACL. Are there different kinds of surgery that you can do for that?
There are multiple different methods, like things that you can do to use to reconstruct the ACL, whether it be using your own tissues, using part of your patella tendon or your hamstrings, or using a donor graft. And all of those are patient specific, what you use and in what circumstances. And
So you just find either a tendon that the person has or a cadaver tendon, and you just replace the ACL, you just sew it on?
Correct. You put it into the bone. You cannot repair their native ACL. They tried to do that in Europe many years ago, failed all the time.
Doesn't work. Let's go to the meniscus.
Mm-hmm.
Tell me about the meniscus. What is the meniscus?
The meniscus is the shock absorber cartilage between the two bones in your knee. You have one on the inside and one on the outside. And they tear, and they tear with some regularity. Unlike the ACL, they do have a small chance of healing some of the meniscus tears, but generally that's in young adolescent patients. Majority of them do not heal on their own, though. And the symptoms you'll get from that can range from just pain to feeling like your knee is locked up or the knee is giving out from underneath you. And typically those things, once you tear it, will get a little bit better, but if the knee is continuing to give those type of symptoms, pain on one side, locking up, giving out, oftentimes that is a meniscus tear.
How do you treat it? Can you replace it?
Well, first off, if we can, we try to repair it.
How do you repair it?
Stitches. It's not just as simple as that, but stitches and other modalities to try to get blood flow into it. Unfortunately, about half or 2/3 of meniscus doesn't have a blood supply, so a lot of them can't be repaired. If you can't repair it, then you may remove a small amount of it, as small amount as you can to decrease the patient's symptoms. If they have a horrible tear of the meniscus and no major arthritis on either side of the joint, you can replace the ACL with the meniscus with a cadaver meniscus.
How about the ligaments on the outside? You said there's one on the inside and the outside. How do you know if those are torn? We've got cruciate ligaments, and we've got the meniscus, that's the shock absorber on the knee, and now we've got the stabilizers on the outside. How do you know if they're torn, and what's that like?
Well, generally, large majority of the time, if you're going to have a sprain of the knee, it's the MCL, which is the medial side of your knee, the inside of your knee. And oftentimes what will happen is a high school football player or someone that's playing intramural soccer or something like that gets hit from the outside of the knee and has pain on the inside of the knee above and below the joint. And it'll just kind of feel like the knee, once again, wants to give out from underneath you, swells locally in that area, and a lot of pain.
So you got pain, swelling, you get stiffness, and all these things. Does the meniscus do that too?
It does.
The ACL does that?
It does.
So that's a protective mechanism. You got pain and swelling, and you put your weight on it, it says, ouch, I need to go see a doctor.
Yes,
And
exactly.
how do you diagnose the collateral ligaments, the medial and the lateral?
Well, generally, you can examine the knee and
It'll wiggle sideways
wiggle a
where it's
little
not
more.
supposed to.
The knee is generally pretty tight. It gives a few millimeters, but if you have, there's different grades of MCL sprain, but per grade, a little bit more play, a little bit more play, a little bit more play.
When you have any of these injuries of the knee, do you need to get it fixed right away? Can you wait a week? Can you wait a month? Do you have to have it done the next day, that night? Well, what's the time sequence on fixing these things?
Well, there's a big difference between different injuries. If you have a piece of meniscus that's stuck in the wrong part of the knee, that needs to be fixed ASAP, ideally within a week or two after the injury to give the highest rate of recovery and repair. With an ACL injury, oftentimes we have people coming to us the day or 2 days after an injury saying, someone told me I had an ACL. Oftentimes with those, we need to wait a few weeks, let the knee calm down so we don't have any stiffness after the surgery.
Weekend cuts and lacerations. You fall down, you cut your knee, cut your elbow, cut your lip, a little cut below the eye. How do you know if those need to be sutured?
There's many different characteristics. The depth. If you see fat coming out of an incision or a laceration, probably should be repaired or at least evaluated. A long laceration probably should be evaluated. One that's contaminated, it's got dirt or anything else, and it needs to be seen and cleaned out pretty quickly. There's lots of superficial cuts that I'm sure you and I have gotten that
Just wash them off and
they don't need anything. And also anywhere that has a high chance of scarring, your face, your lip, anywhere where a joint's very, very mobile.
Chris, we're out of time. You're a great teacher. Thanks for, I didn't realize there could be so many injuries that we've walked through. We need to tell people to be careful, but if they've got something that's wrong, it has to be evaluated, and we hope the best for them. Thanks for coming to the Dr. Bob Show.
Thank you very much.
Great information for you and me. If you want to stay tuned, we're going to be talking about vitamin D. Can it prevent cancer? We know it helps the bones. And what's the difference between angina and a heart attack? A lot of difference, same problem. We got a lot of information for you. I want to thank Dr. Chris Shaver for his excellent discussion on weekend warrior injuries. You be careful when you're outside, and I hope you don't get any of those injuries. Now, for questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number 1. What is the difference between angina and a heart attack? Well, let's talk about angina or angina. Both of those are correct pronunciations, so don't worry about that. Angina is chest pain. It's chest pain that occurs with exercise, activity, stress, or excitement and goes away with rest. It's usually crushing chest pain right in the middle of the chest. It's a warning sign. What's happening is the blood vessels that supply the heart muscle nourishment become narrowed. The heart needs more oxygen and it doesn't get enough oxygen, so there's chest pain. The body sort of says stop, and so when you stop and rest, that pain goes away, only to come back again when you exercise. This is typical angina. There's more than 12 million people in the United States that have coronary artery disease and have angina. Sometimes it will even occur without rest. We call that unstable angina. Angina is a significant problem, needs to be worked out with your doctor. So what's the difference between angina and a heart attack? Well, let's say that the heart doesn't get enough blood supply and that blood supply is suddenly cut off completely, then the heart muscle doesn't get any blood supply and rest doesn't help that. That heart muscle will die. You have 90 minutes to get to the emergency room and be evaluated and get to the cath lab where they can reestablish blood flow. Let me go through that again. If you're having a heart attack, it's because the blood supply to a certain part of the heart is completely stopped. It can be reestablished with a cardiac cath and maybe balloon or a stents. So if you're having chest pain, crushing chest pain, breaking out in a sweat, pain goes up to your jaw, down the inside of your left arm, or women just may be short of breath and break out in a sweat and they know something's wrong. You need to call 911, take an aspirin, chew that aspirin, and get to the emergency room for evaluation. If so, you can save your life if you get there soon enough. Question number 2, Dr. Bob, I want to have strong bones. Do I need vitamin D supplements? Well, let's talk about strong bones. We need calcium in the bones. We need vitamin D to help calcium be absorbed. We get enough calcium in our diet. We can get calcium with milk and some leafy green vegetables, or we can take calcium supplements. After the age of 40, women need 1,500 and men need 1,000 milligrams of calcium with vitamin D. Now let's go to the question, vitamin D. Do I need vitamin D supplements? Because it's the vitamin of the year. There is so much information coming out on vitamin D. It's synthesized by the sun. UVB rays, ultraviolet B rays on the skin will convert to vitamin D so calcium can be absorbed. So the sun really helps us from that standpoint of the body producing vitamin D. But let's say you've got sunscreen. Well, it will keep the UVB light from activating the skin. Let's say you're at an area where the sun is not straight above the head. You're at a latitude where there is not a lot of strong sun rays. Or let's say you're out in the early morning or late evening, the sun is not very strong. Then you're not getting enough vitamin D. So you need vitamin D supplements. Now, there is some new information that vitamin D supplements can do a couple of other things that would be very beneficial. There's some suggestions that it may decrease the incidence of colon cancer, breast cancer, and prostate cancer. There is some reason to suggest that it helps the immune system, cutting down on upper respiratory infection. If you're having recurrent upper respiratory infections, you need to get a vitamin D level. Bottom line, we learn every day and get new information, but calcium with vitamin D is good. Have your vitamin D level checked. If it's low, you need to take supplements. Well, that's all the time that we've had for this show. Remember, we like to end that show with exercise. You need to be exercising every day. Make it simple, make it fun, make it where you can get your body active. Eat good food. Eat less food, better selection of chicken, poultry, vegetables, fruits. 8 hours of sleep, you'll feel better, you'll do better, people around you will do better. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. I can't tell you how important laughter is. Laughter will help your immune system. It's been shown to do that. But it'll make people around you happier, you'll be happier, and you'll stay healthier. Laugh a lot.